One. Hello. Wonderful. Good morning, everyone. My name is Heather Flattery, and I am the Manager of Membership and Marketing at the Society for Public Health Education. We are so glad that you are able to join us today for our coffee chat. Now, if you're not really familiar with our coffee chats, we had in the past year really introduced some exciting conversations with leaders, thinkers, doers in the field of health education and health promotion. And one of the things that we wanted to highlight was who's who in the industry, what resources, are out there, and what opportunities do we have to be able to continue to build collaborative partnerships and find ways that we as public health educators can really have an impact on health education and healthier outcomes. So I am actually joined today by two of my professional colleagues over at Safe States Alliance, and I'm going to allow them to introduce themselves to you in just a moment. And so the way that this is basically going to work, we are going to have some light introductions in the very beginning. We will tell you a little bit about Safe States and the work, the good work that they are doing, and some of the amazing resources that they have available for you. Keep an eye on the banners, and I will be projecting some things so that you can log into those now, later. Make sure that you take advantage of those resources at any given time that seems available for you. And then at the very tail end, we'll keep it light and easy. It is a coffee chat, so I did bring my appropriate beverage. But we might do some light rapid fire questions. So I have some really fun, just who's who and what are you guys up to learn a little bit more about Krista and Shelley. So why don't you take it away? I will allow you both to introduce yourself and tell us a little bit about Safe States.
Great. Thanks, Heather. It's wonderful to be here, and I'm happy to share a little bit more about us and about Safe States. My name is Krista Thalen, and I'm a program coordinator with Safe States Alliance. And I'm also happy to say I'm a member of Sophe and a fellow health educator by training. So great to be among my peeps. Telling a little bit more about Safe States Alliance, we're a national nonprofit whose mission is to strengthen the practice of injury and violence prevention. We have over 600 members who come to us from state and local health departments, hospital trauma programs, nonprofits, universities and schools, tribal organizations, and we all work together to look at unintentional and intentional injuries and ways that we can work together in reducing and maybe even eliminating those. So with some of our programs and services that we offer, we have a mentorship program that we've just kicked off that allows our student members to engage with our mid-professional and maybe seasoned professionals to learn more. We have a podcast that we have just launched and have a couple episodes coming up that we're going to be excited to share with folks. And I'm glad that you're kind of sharing those banners along as I'm talking, because I want to be sure that people see and have the links to that information. Other programs and services that we offer: assessments on state health department programs. We offer some technical assistance in shared risk and protective factors. And I think I'm going to kind of wrap up and let Shelley say a few words now. So thanks.
Thanks, Krista, and thank you, Heather, for having us. I am not a Sophe member, but I have attended several Sophe conferences, and so very happy to be here today. I think Krista did a really good job of kind of giving you an overview of some of the Safe States programs and things like that. One of the things that I would add is that we offer a lot of educational opportunities and training opportunities that are cross-cutting. They're not just for injury and violence prevention professionals, certainly cross-cutting for the field of public education. So I encourage all of your members to check out our website. You'll see the banners across the top of it that talks about some of our programmatic things, some of the tools that we have available, our education opportunities. We also do a lot of advocacy work. both mostly at the federal level, but trying to branch out and help our members advocate on a state basis as well. So I will stop there, and I'm anxious to see if there are questions from Sophe members.
Perfect. I do think we have one person joining us online, so this will certainly be something that we'll post about afterwards when we do like a follow-up on some of our social media, and we'll be sure to share that with the Safe States Alliance as well. I'm really excited to learn a little bit more. I know I've been tuning in to some of the In Touch podcasts and some of the amazing work that you guys are highlighting through there. When you go to, I guess, build a podcast, or when you're looking at some of those programs that you want to highlight, what are some of the brainstorming things that come up for that? I know that, I guess what I'm trying to say is the world is so big. There are so many things we could talk about. So do you find ways in which it aligns strategically with maybe your strategic plan? Or is it kind of checking in on the relevance of like what's happening in 2021? How do you guys kind of work on building some of those content areas for your podcast?
That's a great question. And yes, you hit it on the head in looking at what's going on in the world. Hopefully coming out of this pandemic, and, as a field in injury and violence prevention, just really excited to see how we can do things differently. And with the podcasts, we talk about doing our programming differently, how we can look at our data differently. And up and coming, we're going to be talking about some legislation, and especially what's coming from the federal government on down to public health programs. It's very exciting to see that public health infrastructure is getting some focus now. Yeah. After the many years of us working behind the scenes very diligently in addressing the issues, but now being at the forefront. It's very exciting. I wanted to just make another quick plug with the training center and our annual conference. We're also looking at some of the education and sharing that we can have with members and non-members. And I know that Sophe members will be interested to know that we offer CEUs for CHES and CPH with both our training center and annual conference. So just something else that they'll find of benefit from Safe States Alliance.
Perfect.
And Heather, I would just add to that if nothing else, 2020 and 2021 have given us an opportunity to rethink how we and reimagine, and that's honestly part of the theme for our virtual conference, which will be virtual again in 2021 in it's August 31st through September 2nd, I believe. But we are also, and Krista mentioned the podcast. It is, it could get a little confusing because we're using the words IN to brand everything. So the podcast is in depth. Our newsletter is in sight. Our online collaborative community is in touch. And we're just about ready to launch a digital resource hub that will be capital IN informed.
I love that.
So
is that because of injury, like injury violence prevention? Is that what, am I drawing the connection there? Okay, I love it. Yeah, I think you both absolutely correct. And for those of us who've been working in public health, right? For those of us who work in and around even working with our academicians and people who are doing the research and the practice, it's interesting because I think we all know, they've said the infamous they, right? I think that one of the common phrases is an ounce of prevention is worth a pound of cure, right? Like we know that by giving into the preventive methods, giving into understanding preventive care or, learning about our social determinants of health, identifying these causes of injury and violence prevention, we can have that impact. But now I think the dollars are starting to show up because we're actually able to show some of that, through evidence-based practice and through performance evaluations and things of that nature. It's always hard when obviously if the numbers are lower, it's because I'm doing a good job. But how do you know that when, they want to see evaluation and numbers and all these other kinds of things? So I think that's always been the challenge with public health as an umbrella term, but then especially like all of our nuanced areas of health education and even our advocacy and, how you fight for those advocacy dollars and those ways to spend down funds for health educators and folks working in this field. So I totally agree with that. I also want to plug a couple of, you were mentioning a little bit about abstracts, and I don't know if you guys have calls for abstracts open. That already closed, right, for this upcoming conference. But you mentioned your conference is coming up in August. So again, we'll continue to share your website, and I want folks to check that out. Go ahead and register for that. Sophe is actually going to be, we just concluded our 2021 annual conference virtually, and we will be putting out a call for abstracts. We currently have one active right now through June 11th of 2021. That's for our Advocacy Summit, which will be focusing on those social determinants of health. And then we will also have another one opening probably by mid-June for our 2022 annual conference. So lots of things happening right now, lots of great opportunities to be seen and share research and provide some of that base knowledge so that we can share that amongst our colleagues and make sure that we are really having that impact. That's why we do what we do. So those are some really neat opportunities I wanted to shout out on behalf of Sophe also. Really quickly, I'm kind of jumping ahead, but I wanted to pinpoint that we also have a calendar, and Sophe's calendar really is great. If you want to just look at some of the live webinars that are coming up, all of those are free. As you guys mentioned, CE, so you can earn continuing education if you're CHES or MCHES with Safe States Alliance through the annual conference. You can also do that with a lot of our on-demand products. So if you wanted to view a webinar or do one of our courses, you can do that through our eLearn at Core as well. And all of the first runs are free through like the website. So if you wanted to check that out, you can check it out. But if you actually wanted to pay for the CE, that's sort of a follow-up step after the fact. So yeah, I think all of these are really good, and it's important to make sure that we are providing some of these links. So I'm going to share again. I know you gave me some information related to your IVP tools. Can you tell us a little bit more about, I guess, just expand on this? How can someone find maybe different ways to have an impact, and what are some of the things they'll find when they get to this page?
Sure. So one of the things that we have found really helpful is the IVP orientation toolkit. And this can be for newer employees. Also, managers and supervisors like to use it with performance evaluations and professional development, and helping to kind of create a baseline and then build upon that. Let's see, I was just going to say one other thing that we are in the process of creating what's called IVP 360. On our training center, the most popular self-study that we have had is called Injury Prevention 101. And it's amazing, but what we're finding is the technology has definitely advanced since this self-study was created and recorded. And so in keeping up with the times, we are kind of taking the best from Injury Prevention 101 and putting it into IVP 360. And Shelley and I have been working very hard on getting that together. And we're hoping that by late summer that will be available, and folks will be able to go on our webpage and find that. Not sure what section it's going to fall under, maybe the education or tools, but then also on our training center as well. But there are a lot of tools on there. I'm not going to probably have a chance to list down through each of them, but we have some assessments. We have for state, local health departments and hospital trauma programs, some assessments that the departments and individuals can take part in to, again, kind of get a sense of how their program compares to maybe like best standards. And then one of our programs that we offer is called State Technical Assessment Team, where members sign up to go and do an in-person, lately a virtual assessment of programs and help create some recommendations for that state health department. And the tools that we have are just really helpful to members. They enjoy the opportunity to be able to kind of take an internal look at their programs and services and see how they can improve.
And Heather, I might add that something that would probably be of interest to you, Sophe members as well, is a lot of our tools are aimed at helping people, individuals think broadly, more of along a systems thinking approach. Instead of, because we all know that the resources are just, the resources are limited for public health, certainly limited for injury and violence prevention. And one of our newer tools is our Connections Lab that really shows how to work across silos and disciplines to look at shared risk and protective factors and look at doing more of the upstream prevention. How can we change the environment to make it safer and healthier for everyone? How do we implement policies that are equitable across all populations and things like that? So a lot of the materials that and the resources that Chris has just talked about would be very beneficial to not just your members who directly do injury and violence prevention, but other public health initiatives and things like that.
Absolutely. Yeah, I was literally thinking upstream when you were talking about that, right? Because we need to have that impact, as you said, sort of breaking down those silos, really figuring the strategies and the implementation measures from like a policy change level and a systems change level, because as you can impact there, it will trickle down and you'll be able to have that more tactile impact. I just attended a webinar. It was actually one of our last ones for the Sophe 2021 DX conference, and they talked a lot about that. And they incorporated some really awesome, just like mapping visualization, looking at breaking out these quadrants or these areas, very self-guided by individual groups. Maybe they were in an academic setting where they were looking to, just solve a problem, whatever that problem might be. And then they looked at, okay, well, what are the external, what are the internal factors? And then as they broke that down, really fine tuning, okay, well, what can we actually have an impact and what are sort of those uncontrollables, so that you figure out if some of those uncontrollables actually do have one person that is a plug to being able to like make a petition to hire up leaders or get funding, then you've got to use that lane, right, of communication. If there are multiple people that can kind of attack that problem, then you have different ways that you can go about it. So I think you're right on. And I really think that so many people in both of our organizations, but in public health and health education, need that kind of lens as well. They need a little bit of both, because it's really important to have that and to be able to bounce back and forth between different learning styles and how you can have impact. Yeah.
Otherwise, it would just get really overwhelming, because there is no one individual, whether they're in a state or local health department or a hospital-based trauma program.
Yeah.
There's not one entity that can do it. And we really do need to be collaborating and figuring out what's already out there instead of recreating the wheel. And and we need to be talking to each other as well.
Clearly, right? We need to be building these partnerships, these bridges. So that's a perfect segue. We have a few minutes left. These conversations were intended to be short but sweet, and give us lots of information in a very succinct manner. So before we finish up, we're going to do a little bit more of kind of a personalized approach. I want to learn a little bit more about you both outside of your working relationships, right? Because we are whole beings. But really quickly before we dive into that, where can we find Safe States? What platforms are you on? How can they find you guys individually if they wanted to reach out about membership? I know, Christy, you're heavily involved with that for Safe States. Do they find you on LinkedIn? Tell us a little bit about that.
Yeah, so Safe States is on LinkedIn and Twitter, and definitely with our website too, safestates.org. in terms of finding us individually, we have a section on our landing page of our website that lists staff. There are 9 of us, and we are spread out across the nation. We actually went remote before the pandemic forced us to, so got a little bit of a heads up on working remotely. But we serve the nation, and just ways to reach out and email us, call us, set up a Zoom meeting with us. Happy to do that.
And we just launched our YouTube channel as well.
Oh, great. Love it. Perfect. So we'll make sure to link to some of those things when we go back in and share this post with others. I think that that's really important. And as you were mentioning, a 9-person team, small but mighty. I have found that also at Sophe, we're a staff of about 11 with rotating interns every few months. And we get a lot done with just a few of us, but it's never easy, but it's always so rewarding, I think. For me, being able to work with our members and being able to provide the knowledge and expertise that I think so many of our members actually bring to the table is what's really rewarding for me. So really quickly, we'll pivot to a couple of things. When you're not working, tell me really quickly, we'll do a couple of rapid fire, just personal questions. What do you like to do with your time? Do you tell me where you spend your time? What do you like to do?
Shelley, I know you want to share. Go ahead.
So Kristen knows that my first grandchild, a granddaughter, was born 2 weeks ago. So I have, and she's in Oklahoma. I'm in Dallas, Texas. And so I've spent the last 2 weeks in Oklahoma with her. And my other fun thing that I like to do is photography. So you can find me on Instagram, probably not posting a lot of pictures of my granddaughter yet, but I'll certainly be taking a lot of photos of her. Krista?
Very good.
Spending time with family. We just had our 2 college kids come home for the summer, so looking forward to spending time with them. I have 4 kids total, so it'll be a busy house for the summer. And I am really looking forward to more travel, that we can get to some new sense of normalcy. It feels like it's coming, and it's so exciting to think ahead of what's to come.
Same. I think when a bunch of articles started to come out, just about a year and a couple months prior to right now, right, this timestamp a year ago, a lot of people were talking about these handful of things that you were starting to experience. And one of them was like that lack of expectation, right? Like in the spring, you're like, oh, it's going to be summer. I'm going to go to the beach. I'm going to go somewhere, anywhere. I'm going to see somebody. I'm going to explore a concert or do whatever. And it was that sort of brick wall of like not having that thing to look forward to that was really just, oh man, it really hit a lot of us, I think, whether you're introverted, extroverted, in a different sort of way, because to have something that you took for granted maybe and then not have it was so weird. So that actually is a perfect segue. What's one thing you're really excited for this year? Maybe Shelley, yours already happened. I don't know. But what's one thing you're really excited for in 2021?
Wow. I'd probably say going to concerts and music events, shows. I mean, just, you're right. Like when everything shut down, it was just so sad and depressing, not going to a movie theater, not going to a Broadway show. So having those things available again really excite me.
Yeah.
And I just booked my first trip. I used to travel, at least 2 or 3 times a month. And I have been nowhere besides Oklahoma since March of 2020. And I just booked a trip to Hilton Head, South Carolina with my best friend in a few weeks. So,
oh my gosh, Hilton Head is fantastic. Can I just say? And one of the best things I didn't think I would love, you can ride your bike on the beach. The beach sand is so firm. So you've got to rent a bike. You've got to go out and just ride. It is like the coolest thing ever. Okay, a couple of rapid fires. You probably already kind of just answered this, but do you prefer the mountains or the beach?
I'm going to say beach. I just moved back to Michigan, and Lake Michigan is just very special to me. So I'm looking forward to a lot of beach time this summer.
And I would probably have to say mountains. I love the beach, but I'm also a snow skier, and Krista just moved from the mountains, and I'm anxious to get back on the slopes, and if not in 2021, in 2022.
Yeah. How about cooking or baking? Do you do either? And if so, what's your preference?
I don't do much of either, but probably prefer baking to cooking.
Okay.
Ditto.
All right. And then lastly, how do you start your day? And maybe send us off with one fun little thing that maybe brings you joy, or that is impactful for you about just kind of getting your day started or starting each new day. Is there anything that jumps out that you either want to create a habit of or have found that you've been able to implement? Anything you want to share?
I think it's kind of nice in the morning to start off. So I have kids that are waking up in teenage years, and not always the most enjoyable, but my dog's waking up and just being excited for the day is just really kind of cool way to start the morning, and just
comforting.
You're just happy and ready to go.
I think if we just try to live like dogs, we'll all be a lot happier. Like, we'll just be a lot happier.
Yeah. And I would add to that, I think, and this is definitely a COVID thing. I haven't ever done this before, but during the pandemic, I have started waking up and either running on a treadmill or running outside or something like that. So I found that I never thought I'd be a morning person and never thought I could exercise in the morning. And that is something I look forward to. But I will end with, I was just listening to a podcast where they interviewed, I think it was Brene Brown had interviewed Oprah Winfrey about the new book that she's written.
What happened to you?
What happened to you? And she said that she starts her day before she gets out of bed thinking of something to be grateful for. And that was, I didn't do it this morning. I need to write it down so that I can see it first thing when I open my eyes. But I think that's a good way to start the day.
Yeah, I love that so much too. And that book is definitely on my own to-do list, because I just feel like something that has always really impacted me and intrigued me is really looking at that lens of trauma. And I think that posing that question that way versus like, what's wrong with you? But being like, what happened to you? Like, what makes us who we are versus like, how come we are the way that we are? Like, I think just that simple shift of being able to have that perspective makes us nicer human beings, but also like, it allows us to have compassion and understanding, so I think that that's really important. Well, thank you so much for joining us today. This was short but sweet, and we packed so much in. Again, I'm going to share the link to make sure that you check out safestates.org. We will continue to do collaborative things together, and this is obviously just a little taste of that. But there are so many opportunities between our organizations, not only to share research and practice, but have that sort of camaraderie among colleagues. I think that's what's so beautiful about associations, to find people who are your tribe and are often problem solving and battling the same battles that you may face, personally or professionally, can be so rewarding because you have these regular, consistent things that you want to try and, improve upon. And I think that that's really important when you have that type of an association or membership group that can really speak to that, because it's not like you have to play catch up. You kind of already are speaking the same language. And that's sometimes really important. So again, thank you so much. I appreciate you visiting us. I will go ahead and end our broadcast for today, but stay tuned for the next coffee chat with Sophie, and we look forward to having you. Thanks all.
Thank you.
Bye-bye.